Knock, knock, knock. Provide privacy, hand hygiene. Hi, my name is Brittany. I'm a student nurse at York Tech. I'm here to do a brief assessment. Is that okay?
Mm-hmm.
Can you give me your name and date of birth?
Kenny Hughes, January 5th, 1987.
Do you have any allergies?
No.
Do you know where you are today?
The hospital.
Do you know why you're here?
Yes, my throat.
Do you know what day it is?
It's Monday.
Patient is alert and oriented ×4. When coming into the patient's room, make sure you observe the surroundings, looking at any hospital equipment that's in use, just to make sure it's being properly used. First, I'm going to start looking at your eyes. Can you fixate at one point? And I'm going to check your eyes. Okay, follow my pen to your nose. Alright, the patient is Perla at 3 millimeters. I'm going to check your conjunctiva. Open. Okay, the conjunctiva is clear and white. Lips are of normal color. Can you open your mouth for me? Stick your tongue out. Checking the mucous membranes, looking for any types of lesions. The mouth is moist. The tongue is pink, normal color. Next, I'm going to check your ears. Checking for any types of secretions. Do you have any pain in your ears?
No.
How's your hearing?
Excellent.
Okay. Next, I'm going to check your throat. Checking for your lymph nodes. No swollen lymph nodes. I'm going to check your hair. Hair is evenly distributed. No abnormalities. Looking at the face, looking for symmetry. No drooping. Also with the whole body, just looking for symmetry. Okay. Next, I want to check your skin turgor. Skin turgor is normal. Now I'm going to sit you up and I'm going to look at the skin on your back. I'm looking for any types of lesions or rash, checking the texture, also feeling for the temperature. If there's any wounds, you want to make sure you assess the size, the appearance. Also, if there's any types of drainage, any dressings, or any drains coming from the wound. Now I'm going to listen to your lungs. I'm going to listen in 8 spots in the back. Every time I move my stethoscope, just take a deep breath. Okay? Okay, the lungs are clear bilaterally, no abnormalities. Now I'm going to check your skin on your chest. Looking for the same thing in the back. Okay, I'm going to also listen to your lungs in the front. I'm going to listen in 6 spots in the front. Deep breath. Okay, lungs are still clear. Now I'm going to listen to your heart. Before I start, do you have any types of secretions, cough, or shortness of breath?
Mm-mm.
Okay, and if the patient was on oxygen, you want to check that delivery as well. I'm listening to your heart. Okay, the heart rate has 60 is 65 with a regular rhythm. I'm gonna get you to lay back. I'm gonna assess your abdomen. I'm gonna be looking at the size, the shape, looking to see if it's symmetrical, which it is. Next, I'm gonna listen to your bowel sounds. Okay, I heard 18 bowel sounds. The bowels are active. I will listen for 1 minute in each quadrant, 5 minutes in each quadrant if I heard no sounds. Also, in addition to assessing the abdomen, the size, shape, and symmetry, you also want to assess the skin as well. Can you tell me when your last bowel movement was?
Yesterday.
How often do you have bowel movements?
Every other day.
And can you describe what your last bowel movement looked like?
Brown and hard.
Okay, and what about your urination? How often do you urinate?
About 7 times a day.
Okay, do you have any type of pain or discomfort when urinating?
No.
No other issues?
No.
Okay. You want to also make sure you're assessing your patient's eye and nose during your shift, if applicable, and also checking their catheter, checking the urine output, and also what the urine looks like. Next, I'm going to assess your capillary refill. Okay, with less than 3 seconds on both hands, so it's normal. Next, I'm checking your nails. Looking for any types of streaks or dents or abnormalities. Those are normal. Next, I'm going to check your radial pulse and your respirations. Okay, radial pulse was 65 regular and normal. Respirations were 14 regular and normal. Next, I'm going to check your blood pressure and your oxygen saturation. And I'm going to get the approximation. Okay, my systolic approximation is 102. Pump my cuff up to 132. Okay, blood pressure was 104 over 62. Okay, patient's oxygen saturation is at 94. Next, I'm going to check your pulses bilaterally. Okay, all of the pulses are equal to plus. I'm also going to assess the skin on your arms. Always assessing the skin. Okay, next I'm going to get you to sit up for me and walk. Okay, this is assessing the ease of ambulation, balance, and coordination. Raise your arms up, roll your shoulders, roll your wrists, roll your fingers. Okay, lay that down. And raise your legs. Roll your ankles. Move your toes. Okay, that's assessing range of motion. Next, I'm going to check your strength. Good. Push back. Good. And grip my fingers and squeeze. Good. Strength is equal. Next, I'm going to check for any peripheral edema. Okay. You're also assessing the skin on the legs, also the hair on the legs. Making sure you don't see any bald spots or any shiny type skin or discolorations or lesions. Also noting if the patient has any kind of cast or traction applied, any musculoskeletal things. And of course, I don't have a thermometer, but I would also take the patient's temperature for vital signs. Okay. At the end of your assessment, you always want to make sure the patient is comfortable, bed in the lowest position with side rails up, call bell within reach, and hand hygiene as you exit.